Ladies and gentlemen, welcome to Triple N Media. I am Dr. Nik Nikam. I'm a cardiologist. I want to share my experience working for a government hospital as a cardiologist online for 1 year. Anytime you apply for a job, it is pretty obvious. It takes 4 to 6 months or 8 months to get a job. Once we get the job, then we begin to work. Initially, it will be very hard to find an online job by itself. But anyway, I used to go 1 week a month to the location and see patients. After 3 months, I thought the travel was too much for me. So I just told them that I can just do whatever possible online. So from the 3rd month onward, I did mainly online work. My work included reading electrocardiograms, cardiac monitors, echocardiograms, and seeing patients on consultation through the video conferencing. I mean, of course, this was a secured video conferencing through the hospital protected network system. What I have learned is that we can accomplish most of the things we want to do when we are seeing patients online. The best part of this is, of course, I don't have to spend an hour on the road every day. Since I live in Houston, anywhere you want to get to, it's going to take more than an hour. So I don't have to spend an hour in the morning or an hour in the evening to go to work and come back. That's one of the big advantages. Number 2, I have set up my home office. As you can see to my left, you can see my home office computer, which is set up for my work, which is totally different from my computer, which I use for my personal use. So generally, I get up at 6 o'clock, and by 7 o'clock, I am at my work desk. Usually, we go to work at 8 o'clock, but since this is a home office, I can start my work anytime I want to. I can do it on Saturday, I can do it on Sunday, and I'll tell you exactly what I do in the evenings. Anyway, as soon as I get up, I start the computer, which takes like 5-10 minutes. Then I look at the chart and review the patients that I'm supposed to be seeing, 2 or 3 patients in the morning, and I prepare their notes, which takes considerable amount of time, at least 30-40 minutes to prepare their notes, since all these patients are new. And I'm very meticulous about what I do. So that by the time I talk to the patient, I already know what is wrong with the patient and what the medications the patient is on and what are the diagnoses and what are the tests that have been done. My main aim is to focus on what they are telling me and then take their history, combine that with the information I have, and come up with an updated diagnosis and any diagnostic test that I need to order. I order those things. I also order new medications if needed. And since the hospital where I work, I have to enter the orders for the tests and for return appointment. And all these things are done by myself. That's why it takes a long time to prepare and complete the notes. That's one of the major challenges when you work for hospital systems that expects you to do all these things besides just seeing a patient and doing your notes, because you have to do the appointments, you have to do the laboratory tests, x-rays, stress tests, echocardiogram, CT, whatever needs to be ordered, we order those things. Then we move on to the next patient. So in this way, I see 2 or 3. That's why I don't want to see too many patients. I just see like 2 or 3 patients. Then I'll come back and see if there are any EKGs that are added on to my basket. I read those EKGs, and when we read the cardiac monitors, we have to prepare a report which has to go into the electronic medical records. When I'm reading EKGs, if I see something abnormal, I make a copy of that EKG and find out who the primary doctor is, and we send them a copy of that EKG with the latest findings through a secure team message, since the system uses Microsoft Teams. In this way, the primary doctor is alerted to if there's a change in rhythm, for example, from sinus rhythm to atrial fibrillation with rapid rate or atrial flutter with rapid ventricular response. We send them the message. Same thing with when we read the cardiac monitor. If somebody has significant pauses, who may be a candidate for pacemaker, we inform the doctor with the findings that this patient has an abnormal cardiac monitor. And when we see the patients for consultations, sometimes we may have to send them to a medical center. Since we work for a small hospital, if they need a cardiac catheterization or electrophysiological evaluation, they have to be sent to the outside heart hospital, and we have to make a consultation request to them or outside consultation request in general, and then the hospital will transfer them to appropriate facility depending on who is available and what services are needed. So that is as far as the daily work is concerned. And as I said, I also read echocardiograms, and sometimes the echocardiograms may not be all completed by morning, but when I come back in the evening around 6-7 o'clock, I'm sitting at my computer, which is 2 feet away from my work computer. I just turn to my work computer and see what work is left, and if there are more EKGs and cardiac monitors added, I read those tests, and then I look at the patients for the next day, and if I have time and if I'm in a mood, I prepare their notes beforehand so that my charts will be ready for the next day. So the process repeats. One of the advantages of working online is we can set our own schedule, and we can set our own volume of work, and we can set the time of our work, which makes it extremely flexible. I live in Houston, and I started practice in 1980, so until 2017 I was working full-time. Then I worked full-time for a VA hospital for 4 to 5 years. Now I just do online work for a federal institution. So there are several advantages to working online. As I said, your office is your study room, but also you need to have a very quiet environment. You can't even have your phone ringing when you are having teleconference with a patient, because obviously that's going to be reported and it's just going to create a headache. Then you're going to be getting calls. Whenever you work, you're going to be getting calls from your chief about certain things that need to be done according to the system. And the best thing is to learn the system and go along with the system. If we don't go along with the system, there's going to be a lot of friction, and that's going to be pretty obvious when we start a new job everywhere. So the best thing is in the first several weeks is to learn the system, how the things are done in that institution, not how things were done in your place or the last job you did. That has no relevance to what you're supposed to be doing at the current location. So learn the systems, stop fighting the system, just go along with the flow and do it. And once you do a good job and they see some results in the patients, that you're making a positive difference in their lives, in their symptoms and in their quality of life, then I think everything will fall in line. I feel good about doing cardiology online because this is the next best thing to being in a private practice and seeing patients face to face. In fact, we see patients face to face during teleconference because we are just two people talking to each other along with a nurse who is assisting us. We also can hear their heart sounds, lung sounds, carotids using an electronic stethoscope, which makes it easier to identify any gross pathology. Most of it is going to be dependent on the history. So based on the history and the complete electronic record which we have in front of us on the second monitor, we come up with a composite diagnosis, and we come up with a list of tests that we need to do, like an echocardiogram, a cardiac monitor, or a stress test, or some blood tests. and then order medications, and if you have to send them for a consultation, we take care of those things. And this is my daily routine, and I have been doing this for a year, and I enjoy what I do because I feel I am making a positive difference in the lives of individuals. Take, for example, the patients I am seeing are in a city where there is no cardiologist providing services through the system I'm working with. These are just satellite clinics. They have no cardiologists there. So these patients don't have to travel to the main medical center hospital located in one city, which could be 100, 200, 300 miles away from where they live. But now they're getting the same service they would have gotten if they had come to the medical center hospital, central location hospital, which was 300 miles from where they live, because I'm talking to them as a cardiologist, trying to get their history, combining their electronic record information from the past and coming up with a composite diagnosis, medications and recommendations, tests and follow-up. So they're getting the same treatment they would have gotten if they had to travel. So I think it is a win-win situation for me. So I don't have to travel on the street. It is a win-win situation for the patients living in remote corners of the United States who can be seen and served with equal quality assurance in terms of what they need in terms of medications, tests, or procedures, or interventions, or surgery, whatever it is. And in this way, I feel very gratified and also sort of mentally fulfilled because I am providing them a service and they are getting a service for which they would have been required to travel 100, 200, or 300 miles each way. So that is my experience, and ladies and gentlemen, if you have any particular questions, please do put them and I'll try to answer those questions to you. And since I'm working for a government hospital, I am getting Medicare rates, and even though we work part-time on a fee for service basis, still they withhold taxes. So the money I make is very, very nominal compared to what most cardiologists make in a private setup, but that is not my main aim. I have practiced cardiology for 40 years. This is just for me to keep myself busy, stay in my field, and do provide some service to people in remote corners of this country, providing valuable cardiology opinion and recommendations, which I think helps them, it helps me, and it helps me to pass time. So this is my story, and as I said, if you have any particular questions with regard to getting a job, with regards to working, with regards to the finances, with regards to the holidays and all these things, I will be more than happy to answer those questions. Thank you so much for watching this presentation. We have numerous presentations related to cardiology, and please do watch them, and please do subscribe to our YouTube channel. I will see you in the next presentation.